How does addiction impact society? Have you ever wondered how addiction touches not just individuals but entire communities? The effects of addiction are far-reaching, influencing public health, the economy, and social structures. Understanding addiction requires us to look at substance abuse and the stages of addiction, as these factors play a significant role in shaping its impact on society. At its core, addiction is a chronic disease that compels individuals to seek out and use substances despite facing harmful consequences. This compulsive behavior alters brain functions related to reward and memory, making recovery challenging. The implications of addiction extend beyond the individual, affecting families and communities alike. One major area of concern is the burden on health care systems. Addiction leads to increased hospital visits and long-term treatment needs. For instance, the rise of synthetic opioids, especially fentanyl, has resulted in over 100,000 overdose deaths annually in recent years. This surge places immense pressure on health care resources, leading to higher costs and a lack of adequate treatment options for those in need. Economically, substance abuse costs society over $1 trillion each year in the United States. These costs stem from health care expenses, lost productivity in the workplace, and crime-related costs. Individuals with substance use disorders often struggle to maintain stable employment, which further contributes to economic instability and limits their access to treatment. Addiction also impacts public safety. It is often linked to increased criminal activities, whether directly related to substance use or due to impaired judgment. This connection leads to higher incarceration rates and strains on the criminal justice system. Communities face trauma from drug-related violence and accidents caused by impaired driving. The effects of addiction ripple through families and communities. Family dynamics can become disrupted, leading to emotional trauma and financial strain. Children and adolescents are particularly vulnerable, as early substance use can increase the risk of long-term addiction and associated social issues. Stigma surrounding addiction creates additional barriers to treatment. Many individuals hesitate to seek help due to fear of judgment, which can worsen health outcomes and prolong societal costs. Efforts to reduce stigma and promote treatment options are essential for improving recovery rates. To address these challenges, effective strategies are needed. Educational programs and community initiatives can help raise awareness about the risks of substance use. School-based programs can teach young people refusal skills and promote healthy choices. Technology, such as telehealth services and recovery applications, can also expand access to treatment and support. In summary, addiction impacts society through increased health care demands, economic losses, crime, family disruption, and social challenges. Addressing these issues requires a compassionate and evidence-based approach that recognizes addiction as a medical condition needing support and care.